look at the starting from the basics, if they're looking at the PHC levels, PHC is the primary healthcare center. So identifying these patients, diagnosing early, controlling the sugars, very, very important. And yes, once an ulcer is formed, there's something known as offloading shoes that are present, because every time you walk on an ulcer, the ulcer is only going to progress. It is not going to heal. So you need to offload that area and give it some rest so that the wound heals and there's no pressure on that foot. So what happens is you need to have these offloading shoes. It's these are all fancy names, but actually it is a simple way of offloading shoes is having having a bar across the footwear. You can have it on both. You can have it at one foot, so that it is at a height and it's not touching the ground. And your ulcer is not directly in contact with the walking surface. So that is very, very important to know that use of offloading devices. It's quite an old technique, but definitely it has a significant role in healing of diabetic foot. And the other newer techniques, of course, daily dressings. There are these special, debridase ointments. Debridement helps in autolytic eating up of the cells and dead cells, pus cells. Debridase ointments are there, so use that, and then you use alginate dressings, and those. There are multiple dressings that can be used for the wound care, and definitely you have to maintain hygiene. And of course, you need to even have what do you say? You can even have something known as vacuum dressing. So in that, if the ulcer is quite big, you apply this vacuum foam over it, and it's a small machine that keeps continuously sucking out the fluid. And there's a canister. It's a machine. So the patient so once the dressing is done, it is removed only after 5 days. And it's continuously, its battery is there. You can connect it to the power, and it's continuously sucking out the fluid and bringing the wound closer from the wound bed. So